Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Inflammatory bowel diseases, and you're looking at some common findings. So the first feature we are discussing is the most common ophthalmic manifestation. Ophthalmic manifestation will be uveitis as well as episcleritis. The next is the most common ophthalmic manifestation in correlation with relapse. So in terms of relapse, there is episcleritis. Then the feature of arthritis in IBD. So feature of arthritis in IBD is going to include the lower limb asymmetric. So lower limb will be asymmetric and migrating peripheral pauci articular. Migratory peripheral pauci articular. So how do you correlate with the early complications in the CD? So early complications with the CD, it is by the anti-Saccharomyces cerevisiae antibodies. So it includes the anti-Saccharomyces cerevisiae antibodies. Next, predict the response to the surgery in CD. So response to the surgery in CD, this is by the anti-I2 and no role in maintenance of IBD. This will include the steroids, the fecal antigen used in IBD, the fecal antigen. This will include the lactoferrin as well as a calprotectin. So it is a lactoferrin as well as a calprotectin. Now what is the gene involved in the IBD? The gene in the IBD, this includes the NOD2. So there is presence of NOD2 as well as the chromosome 16. To learn and grow daily like this, please do subscribe.